Assalamualaikum warahmatullahi wabarakatuh. We are from Group 2 wanted to presentation about pharmaceutical counseling on children and adolescents. Before that, I want to introduce my group. My name is Putri Alvita Zahra and then my friend is Muhammad Taqiyuddin Al-Faruqi. For counseling on pediatric patient or we know that in children, and then counseling pediatric patient requires a tailored approach due to their unique needs, including weight-based dosing, developmental differences, and limited ability to communicate medication effect. Since young children cannot fully understand or articulate their medication experience, parents and caregiver become the primary focus for counseling. Pharmacists play a vital role in ensuring safe and effective therapy by providing clear, age-appropriate education, simplifying instruction, demonstrating proper administration techniques, and addressing parental concern. By focusing on patient-centered communication with caregiver, pharmacists can improve medication safety, adherence, and outcomes for pediatrics populations. And this is the key principle of pediatric pharmaceutical counseling. First, simplify language. Avoid medical jargon like antihelmintic becomes medicine for worms. The second, demonstrate the administration. Like demonstrate how to measure the dose. Example, using an oral medication measuring dropper, not a household spoon. Third, emphasize timing or frequency. Clarify if those are daily or single dose, like mebendazole. And the fourth is side effects. Please explain about the side effects that may be occur. Like some children can feel a little nauseous, and then if your child vomits or get a rash, please stop the medicine and then go to the doctor. And the fifth or the last is verify understanding. Please ask the parents to repeat your instruction before you ended the counseling. This is the communication technique in pharmaceutical counseling for pediatric patients. Counseling parents about their child medication are require a thoughtful, structured approach, and then pharmacy should begin by assessing the caregiver baseline understanding, then tailor explanation using relatable analogies. Example, this medicine works like tiny soldiers fighting the worms in your child's tummy. Active listening techniques are crucial. Pause frequently to check comprehension and encourage question. For visual learner, demonstrate with actual dosing tools rather than just describing them. And then always provide written reinforcement, highlighting critical details like storage requirement and warning signs. The conversation should conclude with an open invitation for follow-up question, emphasizing the pharmacist's ongoing support. This comprehensive approach addresses cognitive, emotional, and practical aspects of medical management. And this is the conversation to counseling in pediatric with her parents. Pharmacist. Oh, sorry. I will do conversation with my friends. So Taki will be a patient's mom, right? Okay. Uh, prescription with patient named Rapunzel, 5 years old.
Yes, I'm her mother.
Okay, nice to meet you, ma'am. And this is mebendazole chewable tablet. Helps to treat pinworms. Has Rapunzel taken this before?
No, this is the first time.
Okay, let me explain how to use it. So it is a single dose tablet, means one tablet for 6 months, and then she can chew it, crush it, or mix it with food like milk, chocolate, pudding, or etc. So which method works best for her, ma'am?
She's good at chewing tablets.
Perfect. So you can give it today. You may see that worms in her stool. That means the medicine is working. And then some children get mild tummy aches, but please call us or go to the doctor if she vomits or get a rash.
Should I clean anything at home?
Yes, of course. Please wash all bedding, pajamas, and underwear in hot water to prevent reinfection.
Do you have?
Do you have any other question before we finish?
No, that's clear. Thank you.
Okay, thank you, ma'am. And then the next will be explanation by Taki.
So this is the explanation about the counseling on adolescent patient, or as known as teen patient. First, adolescent patients or teenager patients face unique challenges in medication adherence and understanding due to developmental, emotional, and social factors. Effective pharmaceutical counseling requires tailored communication strategies to engage adolescents and support their health outcomes. There are four key principles of adolescent pharmaceutical counseling. The first is establish rapport and trust. Start with non-threatening topics before addressing medication or sensitive issues and emphasize confidentially to encourage openness of the patient. The second is use developmental communication by accessing adolescents' emotions and cognitive, and also using open-ended questions to ask behaviors indirectly. The third is normalizing and reducing stigma. Normalize health issues and medication use to reduce shame patient. And the last key, which is the fourth, is involving adolescents in their care by encouraging questions and active participation in decision to empower self-care and adherence of the patient. This is the communication techniques in pharmaceutical counselings for adolescent or teenager. A technique that can be used is MI, or as known as multifunctional interviewing. It is a supportive way of talking with teenagers to help them make positive changes. Instead of giving advice, the counselor can listen more, ask open questions, and reflects the teen's journey. This helps teens more explore their own reasons for change without feeling judged. MI, or motivational interviewing, encourages this strength and respects their independence, making it easier for them to decide to improve their health, like taking medication or avoiding any risky behavior. This is the conversation example for counseling in adolescent. My friends Al will be act as the teen, and me myself will act as the pharmacist. Hi, this is your asthma inhaler. Do you know how to use it?
I think I just press it a few times and then breathe it out.
Almost. Actually, first you need to breathe out fully before you press the inhaler and breathe in. Want me to show you how?
Oh, okay. I didn't know that before.
No problem. Let's try together. First, you can shake the inhaler, then breathe out all the air, and after that, put the mouthpiece in your mouth. Press once and breathe in slowly.
Like this?
Yes, perfect. Hold your breath for about 10 seconds before breathing out.
Got it. How many puffs should I take?
Usually one or two, as your doctor tells you. Do you have any questions?
I think not now. Thank you.
Feel free to ask if you have any question. Get well.
Okay.
And here are some tips of the counseling and pharmaceutical field for children and adolescents. The first is using simple and clear language. Don't even use any medical or pharmaceutical word, such as mentioned before, like antihelmintic. The second is listen carefully and show empathy to reduce the fearness of the child and adolescent to come to the pharmacy or the doctor. And the third, explain anything honestly. Thank you for hearing our presentation. And if you have any question, please you can put it or write it in the commentary column in our YouTube. Thank you.